Okay. Hello, everyone. WCTSMA and WAHOSA are so excited to co-host this year's Diversity in Healthcare panel. Our event is being live streamed on the HOSA YouTube channel tonight, so a big thank you to all of you watching at home. If you have any questions that you'd like to ask our panelists during the call, please take full advantage of the live chat. Thank you again to everyone for being here tonight.
First, we would like to acknowledge that our schools statewide are on the homelands of Native peoples who have lived in this region for millennia. Currently, there are 42 tribes, 35 of which are federally recognized that share traditional homelands and waterways in what is now Washington state. Some of these nations and confederacies that represent multiple tribes and bands. We express our deepest respect for and gratitude towards these original and current caretakers of the region. As an academic community, we acknowledge our responsibility to establish and maintain relationships with these tribes and Native peoples in support of tribal sovereignty and the inclusion of their voices in teaching, research, and programming. We also pledge that these relationships will consist of mutual trust, respect, and reciprocity.
So today we will have the opportunity to learn about what exactly it means to be a healthcare provider and how challenges and success are woven through all of our journeys. We will be asking questions to our panel members, and feel free to send any questions you may have in the YouTube live chat. So let's meet our panel.
First, we have Nikki Berry. Please feel free to introduce yourself to the audience at home.
Hi, I'm Nikki Berry. I am a school psychologist intern, past teacher.
Thank you for that. Next, we have Dr. Nahi Park. Please feel free to introduce yourself to the audience at home.
Hi all, thanks so much for having me. My name is Nahi. I'm currently a third year pediatric resident at University of Washington and Seattle Children's Hospital.
And next, we have Anna Spartaletti. Please feel free to introduce yourself to the audience at home.
Hey everybody, I was an athletic trainer and now I am currently a teacher at Rogers High Schools doing sports med and anatomy and physiology.
Okay, thank you all for being here on our panel today. So let's go ahead and jump right into our first question. Why is it so important that people of diverse backgrounds are involved in medicine?
I would say that the importance is birthed from the representation aspect that's necessary to create a bridge between communicating amongst people, between individuals who may not come from similar backgrounds. Just as a student feels safer when they see themselves in their school or staff, I think patients are more likely to trust and engage with a system that mirrors their own lived experiences.
Yeah, I couldn't agree more. In the hospital, I mean, there's a long, long history of just mistrust in the hospital settings. When you see patients with diverse backgrounds, and not just backgrounds, but where they live. Do they live in rural areas, urban areas? Where are they from? The biggest things that we see here in the state of Washington is we get a lot of patients from really all over, Alaska, Idaho, Utah, Wyoming. And so we see so many people from diverse backgrounds, from different areas. And really representation builds a lot of trust. It's not what we say, it's what they see. Patients are more likely to follow medical advice. They're more likely to engage in preventative care. They trust the recommendations, especially when they just feel seen, heard, when they feel that their provider has, shared lived experiences. They look like them, they have shared culture. It really, really goes a long way. So absolutely important.
And I think when anyone chooses a healthcare career, it's all about service. And I'm working at a public high school now, and I was an athletic trainer at a public high school, and it's a wide variety of folks, really diverse backgrounds, and it kind of sets you up better to understand those people around you and how to better serve them. And if there's certain customs or other, cultural connections that you have that just give better care and trust, kind of like everyone else has said.
Thank you everyone for sharing. Our next question is, can you share a time when understanding a patient's cultural context changed a clinical decision? And has your workplace made any improvements to accommodate diverse backgrounds?
Yes, sorry. I would say understanding a family's spiritual beliefs or intergenerational trauma, it can completely shift a treatment plan. For example, recognizing that a family has or may have hesitation toward a specific intervention or um, treatment plan is not always non-compliance. It could be a protective mechanism that they're using, and it allows us to adapt our approach to align with their values when we understand more and make more space for a open conversation. That way we can come up with treatment plans that are more effective. I've seen this happen in my field as a school psychologist during an evaluation where perhaps a student's uh, unwillingness to make eye contact with a staff member can be perceived as oppositional defiance or dismissiveness, when in reality, it was a sign of respect from this student's culture, and the failure to understand or just lack of awareness of this student's culture led to a miscommunication that created an implicit bias of hostile treatment towards the student, where the student began to reflect the way the staff member was approaching them. It took a conversation and it took curiosity and people willing to communicate what was really occurring in that situation to bridge that gap.
Yeah, I just had so many patient experiences that I was just trying to filter through which one I wanted to share, but so many. I mean, it's every day when your patient's specific cultural context changes your clinical decision, medical management. It can be as easy as this baby does not want to, with their religion, they can't have pork in their formula. Thankfully, we have formula that doesn't contain any pork products. And so it's an easy decision, but such a critical decision that we have those products available. Some religions, cannot get a blood transfusion. And so there's definitely, ethical dilemmas when it comes to really, really life-threatening situations, but most of the time we're able to really work with the family and at a minimum have a deep conversation. There's a specific patient who they weren't used to, the westernized medicine. And it was their first time being in this country, seeing the hospital setting. And so even, who are all the care teams that are working together? They're used to just seeing one doctor, but here there's so many supports, that they see. There's different ways of doing management, whether it's medicine, surgery, and so, this can be such a long conversation, but I think the most important thing is that it's so important to really understand their cultural context, spend time with them, sit down with them, and you can only do that once you realize there's a huge, huge influence in how their background and context can help them receive the medical care in a way that's very comfortable to them.
As an athletic trainer, I've worked with students that may be fasting due to different religious calendars, um, and to understand that, to know that maybe they are working differently with hotter weather and they haven't eaten or maybe haven't drunk as much as you might think. So kind of adapting that to your practice, especially if they're coming back from an injury and you want to make sure that they are getting the proper nutrition, but kind of working with them, or having a team, having snacks available to someone that might also have dietary restrictions, um, to kind of accommodate those diverse backgrounds. But there's a lot of small things you can do that change a lot and like build that trust of, clientele or folks that you work with. And I think it's super important.
I also wanted to spend time to answer the second question, which I feel like is also really an important question. How has your workplace made any improvements to accommodate diverse backgrounds? Because I want to share that this, you know, all of you can always improve wherever you're working or wherever you are. The biggest things that I have really advocated is to people to use the iPad interpreters in our hospital settings, especially if there's patients whose English is a second language. And I've seen such a tremendous improvement in this. Even where I went to medical school, there were fewer people who were using the interpreters, or saying like, this will be quick. I'm just going to do a quick exam and leave. But that's such a disservice to patients. They deserve better. They deserve to understand absolutely everything that's going on in the room. To really spend time to turn on the interpreter, to be connected with an interpreter, and to actually have good Wi-Fi is so important. But to spend time connecting with that is critical. And so um, I'm so lucky to be in a hospital where people have liked views of that as well. And so every room that has patients whose English is a second language, there's always iPads there that are fully charged. And I've certainly used this every single time, and even in other places like Harborview too. There's iPads, there's different ways. If an iPad breaks down, there's also telephone ways that you can be connected as well. And so these things have been an improvement because someone found that this was a huge equity problem. And so I really encourage you all to look around at your school, your workplace, any places that you're volunteering. And if you see it, definitely speak out and work with your groups to make it happen.
Thank you guys for your thoughtful response on that. The next question is, what makes your background unique and how has it defined you as a healthcare professional?
I actually started my journey as a classroom teacher. I was a high school English teacher for about 8 years. And in that journey, I was also a mother of four the entire time. I got married at 19 and just wanted to hold on to both of these dreams. I was the first college graduate in my family. And I continued to have ambition to move on towards a dream that I started my senior year of high school, which was to become a school psychologist. So I already had a plan written down from senior year that I was going to teach for a while. And I did that. And now I'm getting ready to graduate in May with my third college degree as a school psychologist. And it has been a lot. I'm a returning student, non-traditional, of course. Going through this journey has been met with a lot of adversity, which one would expect. We moved from Southern California at one point and decided to relocate to the Pacific Northwest, where the cultural landscape is quite different. And so I have had to endure a lot of, contradicting influences between, your job is to be an at-home wife and a mother, and also trying to pursue this dream. And with that, I have had to really wear multiple hats. But as a mother, I brought experience working with children and raising children to the teaching profession that served me well. And as a mother of a student who had an IEP and is now a high school graduate, I also bring those experiences as a parent sitting on the other side of a table in a meeting, as well as a teacher, a part of a learning community, trying to support a student with the same needs into this field as a school psychologist. So as I encounter families in the various Title I schools that I've worked at, I see myself in them. And their treatment is very important to me because I've been in their seat often. I'm also not arrogant enough to think that I understand what they're going through completely, because every situation is incredibly unique. But I know the importance of listening and really hearing people and seeing their hearts, and what they all are aiming towards is the best possible case scenario for their child to have the most successful possible future. And so what I bring to the table is just this experience of going through this journey as sometimes the only Black teacher, as sometimes the only Black person some people in my part of the country has spoken to, and someone who is a non-traditional student and found a way to make it work. And so I bring passion, I bring humility, and I bring a whole host of information. So I feel really blessed to be in the position that I'm in, because there weren't always people like me available to talk to. So sometimes when you're the only one, you create space for the next one coming behind you. So that's what my goal is.
Something that I have really loved is mentorship and advocacy, and I feel like I really enjoyed even as a high school student going on to college and med school. I grew up in a really rural town in the middle of nowhere, Illinois, and I had always had an interest in healthcare. I never knew where exactly to start or even how to start this process. And I think the hardest thing was I didn't have any mentors who were in medicine to help me kind of guide the process. And so most of what I had learned was looking at books and buying used books and seeing what has other people done, what are their stories. And I think that really helped me navigate my own ways, and also part of why I love the whole mentorship and also advocacy ways. I think the biggest thing is when there's someone who looks like you or has gone through the same walks, it is so easy to look at them. And so when you don't have that, it is much harder. And so also having this panel and, being able to share my experiences, I'm extremely grateful for this opportunity. Um, Ultimately, I really loved doing all of that, and so I did publish a book. It's called Pre-Med to Med, and I do not encourage you to buy it because it's so outdated now. But I'll to just highlight that, when if you have also endured something in your background that you want to share and help others walk the walk, that is also so possible. And I've loved doing that. Now I'm one of the AAP reps. AAP stands for the American Association of Pediatrics. And we advocate for our little ones. We had advocated to give donor breast milk to babies in need in the hospital, and just being able to advocate for those who don't have voices is so important. And I just feel like the way the upbringings of my background has just really helped fire me to all the things that I really enjoy. And so I would say that has kind of led the way. And last October, I had a baby girl, and I feel like that new journey of motherhood is definitely something that is so new to me, and I'm still learning the ways. Shout out to you, Nikki, for having four children, because I respect you so much. But this, I think, back at work, it has completely changed my lens and, what I view when I see parents in the emergency room or in the inpatient. Um, just that, and all to just share that everyone has such a unique background. I think the biggest thing when I was a high school or college thinking about this question is I didn't feel that unique, but indeed you are. Your steps, your journey is no one has stepped exactly in the same shoes of the paths that you have taken or are going to take. And so I just really also encourage, like, think about all the awesome things that have happened, things that you really had to overcome, to endure because it has made you into who you are today, and things that you can really advocate for the ones who are gonna come after you.
Yeah. So I grew up in California in the Bay Area and, fairly diverse area, and then also worked in Kent, Washington and Puyallup and Tacoma. And so I've met a lot of folks with a wide variety of, backgrounds. And growing up, I played a ton of sports and I didn't really know what I wanted to be. Um, in college, I was thinking different majors and I was thinking different things, but then I took a sports med club and worked in the athletic training room and, volunteered. And I think the more people you meet, the more people you can talk to. And whether you're an extrovert or an introvert and you're working on kind of understanding people around you, it really helps in the future of whatever you do and whatever you're drawn to. I played 3 different sports in high school, throughout the 4 years and pursued a little bit in college. And, I was just around sports a ton. So I was like, how can I integrate this, into a job? Eventually transitioned out of that, but found my way back to teaching where I can connect sports med and anatomy. And it's just a nice kind of marriage of all the things. But also connecting to people on a different level and personal level is so important within healthcare, to build that trust and to kind of understand like where they've been and ask the right questions so that you can kind of figure out, what's going on. Like take that good history and just be open to talk and open to listen. I think listening is a huge thing, of course. But yeah, not a super unique background for me, I guess, but I've definitely done a lot of different things. And I was a SPED case manager before and worked with adapted PE and worked with a lot of students with disabilities. And then you just kind of got to be really creative when you see all the ability levels. So you just kind of be ready for anything in healthcare, open to work with anyone, and you kind of do your best and see what kind of happens and learn from mistakes as well and just have that growth mindset kind of going forward.
Yeah, thank you all for sharing your unique experiences and perspectives and how those kind of shape you in your careers and ambitions. We really appreciate that. Thank you. So our next question for you is, what are some assumptions people may have made about you in healthcare settings, and how did these assumptions affect you?
I can share first. A nurse, many times, there have been patients who told the nurse taking care of them that they haven't seen the doctor when in fact I have gone into the room 3 times. Also, I make sure to introduce myself. And maybe it's because sometimes we have to wear kind of, our isolation gowns, and so they don't see the badge. But it is an assumption. Sometimes when I have gone in to delivery rooms with a male medical student, often look at them first, and ask for, what's going to be the next step. And how did this affect me? I think I just correct them, My name is Dr. Park, and I will be the one taking care of you today. And most of the time, they kind of take a pause themselves and apologize. I don't think I've had any situations where it really needed to be escalated, thankfully. Um, And I think one of the biggest things that I actually had to learn throughout medical school was, how do others perceive me, and what do I need to do to just be better? I think there was a mentor of mine whose lifelong research was how does culture and race affect medical students and the ways that they do their clinicals, which means medical students work in the hospital. And throughout his research, the biggest thing for Asians as a whole was that they were more quiet. If they didn't speak up, it was because they were quiet. From his research, um, others was they just didn't know the information, or, oh, it's just their personality. And so there was a mixed assumption based on the unifying quietness. And so in medical school, I had to work a little bit more to speak up. And, eye contact, I think, as Nikki had shared earlier, that was also, in the South Korean culture, um, looking into the elderly's eyes is a sign of disrespect. And so, definitely when there were attendings that were much, much older than me, in making eye contact, that's something that I had to work towards because I was scared that their evaluation of me was going to be, Dr. Park or Nahi at the time was quiet, does not have interest in this when that is absolutely not the case. And so definitely, how did it affect me? I had to think about what my eye contact was going to be. I had to be aware of, what my voice was going to be. And I would say, there's those things for lots of folks out there. And it still exists. I think it is getting better than 5 years ago in medical school, which I'm really also happy to be in an area where I would share that people are working to be better too and educating themselves more. But still, a lot needs to happen, and including myself, I have my implicit biases and I work towards to make sure that I am a better person. I'm also really privileged to be in a residency program that really highlights the importance of DEI and just understanding our own biases to be better. And so I'm learning myself every single day, and I would say that's really important as well.
Yeah. So as an athletic trainer, a lot of folks kind of underthink, well, at least previously. I finished athletic training grad school probably about 10, 12 years ago. And when I got out of grad school, the understanding of an athletic trainer wasn't as wide as it might be now. I've heard it's been promoted a little bit more, on TV and stuff, and properly calling us athletic trainers. But a lot of people thought we just hand out water and tape ankles, or that you're like a personal trainer, or you do very minimal kind of health care. But it almost felt like I had to prove that I knew my stuff. I had to prove that I knew my anatomy and my ligaments and my ortho eval. And, I'd tell a student like what to possibly expect at the ER or something. And they would go and they'd come back and say, oh, they said the same thing that you did, or, um, things like that. So you do sometimes feel that you have to prove yourself, or that have a little bit of a chip on your shoulder, or, that you want to represent yourself or your school or your program, or kind of wherever you're coming from. And I feel like it does make you better, but it can also, if you keep hearing it over and over, it kind of does beat you down a little bit. Whether you want to change careers or change locations, etc. And so you just kind of have to use it either as a teaching opportunity where you get to teach someone about the profession and about what you can do, or you kind of just let it get under your skin more and more, and then you might experience negative feelings towards what you want to do. And so there's kind of a balance that you have to have. And as you work through things, you can kind of understand that and figure it out as you grow.
I would say that I came into this understanding that professionals from diverse backgrounds will face identity-related stressors. So for me, it's the fighting the stereotypes that linger on site or that seem to haunt the field. As a teacher, I already had experienced times when people thought that I was either a paraprofessional, an intern, a delivery person. All those things are fine as a profession. But as the lead teacher on site or as the school psychologist presiding over the meeting, sometimes it can cause a little bit of imposter syndrome. And so I think that I have to constantly battle, like Anne was saying, like this concept of am I supposed to be here, or do I belong here, or do I need to prove that I'm worthy of being in this space and having these opinions? And sometimes that can get overwhelming and weigh on you, but I lean into doing my job, doing it well. I focus on keeping the kids first and helping to evaluate students to determine if they have a need so that they can get instruction in the language that they speak, as I like to say it. And so I think that whether it be whatever the identity intersectionality that is occurring, the person has to have a resilience of self that says, I belong here, I'm worthy, I've made it. These people gave me these degrees for a reason. And I don't need to prove anything to anyone except that I can do this job and I can do it well. I'm useful in this space. And I think that breaks down the walls when people can interface with either a female or a person of color or a person from a different religion or different any type of background they're bringing to the table. When the person has to interface with it in real life, that creates a space for change to occur. So the best thing that I bring to a table, what I like to hype myself up with, is like I'm bringing me. I'm bringing a unique person. I'm bringing not just a mother or a wife or a past teacher or whatever. I am bringing my worldview as well as my expertise to help you in this setting to get the best possible care for your mental, behavioral, social, educational health. And so I just try to remind myself of that every time I'm in a room.
Thank you so much, everyone, for sharing your experiences. We truly appreciate all your insight. So, building on that, I like to shift towards how we can move forward. So, the next question that I would like to ask is how can we, as future healthcare providers, ensure that we are creating diverse and equitable healthcare experiences?
I'm a big fan of reading and documentaries. Also, talking to people that you wouldn't necessarily speak to. Say hi to your neighbors. Ask someone how they're doing today. Join clubs and organizations. Be curious. Be adventurous. And travel. And if you can't travel literally, you can always travel in a book. So that's going to be the English teacher advocate in me for life. Sometimes that's the best way to get away. And as a teenager, I read profusely because my parents didn't let me go anywhere. But I could go to India or Spain or South America or wherever in a book. And I'm a big component of literacy. And if you can join a club, I was in the Hawaiian Club. I was in the Island Pacificer Club, or excuse me, same thing, Island Pacificer. I was in Mecha Club growing up, mostly for the food, but I learned about a lot of different cultures, and it caused me to have a comfort with speaking to people from different backgrounds. So that's my biggest thing you can do right now.
Yeah, for sure. another kind of connecting the previous question and assumptions. So I'm 6 feet tall, I have short hair. I've been misgendered a ton. Um, and I'm also queer. So like a few different things with pronoun and like gender identity kind of come to mind with kind of educating yourself, depending on what you already know and what you've already experienced. But kind of forms have come a long way, like healthcare forms and pronouns and how people want to be identified and, how they feel, how they want to be represented. And so have those, if you're comfortable enough, have those conversations, um, and kind of learn for yourself, since it's not always someone else's responsibility to teach you about themselves, right, to teach you about their identity, um, and to yeah, I mean, like like you said, like join clubs, seek out volunteer opportunities, push yourself out of your comfort zone a little bit. The more people you know, the more people you can understand, the better you can serve them and care for them. um, yeah, I think equity has a long way to go, but we've also made strides within healthcare and in different experiences. Yeah, keep an eye out for inequitable practices and how you can be a voice for change, how you can advocate for someone who might be pushed out to the sides and the margins. Um, yeah, thanks.
Yeah, absolutely all the above. If I add a little bit of my own, really learn from communities that are different from your own. In high school, I was part of APAMSA, which is that Pacific Islander affinity groups, but I attended all the other cultural events. And that was also always so much fun. You just get to meet a lot of people. You get to celebrate different holidays that you're not used to celebrating with your own family. I would say practice humility. Always ask questions and be curious. Really speak up when you see inequity, like I had mentioned with language barriers. I think, most surprised when I started doing research in the field of medicine was, um, you know, and still today, most of research when it pertains to learning about different cultural backgrounds and races is they always don't include a lot of different races. Or even genders. Lots of, research data out there was done on white males for a very, very long time. And really, was it recently that they decided to, add more, add more in like the whole spectrum. And so, when you're doing your own research projects, think about that too. You can easily, add that variable as well. And I always think about like who is a good clinician, who is a good doctor, and it's really not who is the most, who is the smartest one in the room. That is no longer. Maybe that was like 2, 3 generations ago. But thankfully, luckily, that is no longer who patients want to see as their doctors. It's really, who is a doctor that feels like, I am being heard, who is a doctor who will go that extra mile. And so I would share that like the best clinician is not who is, not who not only has that knowledge, that clinical knowledge, but someone who is, I would say, culturally aware, they're equity driven, and they just want to be the best clinician for that individual person who's sitting right in front of them.
Thank you for those perspectives. On a more personal note, what is one of the most impactful challenges you faced in regards to diversity?
I mean, I guess the only thing that comes to mind right now as an athletic trainer is you work with a lot of male coaches. And being female, it's just there might be some stereotypes or misogyny that you might run into. Um, and so I think trying to navigate that and be confident in who you are and what you say and what you know has helped a lot. And um, to also get perspectives of folks that have been in your situation before. Um, I think that helps a ton. Um, that's the only thing that comes to mind right now for mine.
For me, I would have to say the advocacy component can be challenging. I have often been a minority in the groups that I'm in, whether it be doing my bachelor's degree, my master's degree, now my ADS. And sometimes I have felt like, due to some of the biases that exist that I am aware of regarding Black women and being loud and being obtrusive and being abrasive and all these dramatic things, I have witnessed things that I wished I could have done more to change, and that I want to grow into being better about being more brave to change. Because there have been times, and this is extremely personal, but sometimes I just feel lucky to be there, and maybe making too much noise is making too much noise kind of a vibe. And but I am learning that there are diplomatic ways to go about things, and there are reasons that allyship is so important. Knowing who to talk to and who to recruit to be on your squad, so to speak. There are still cultural shifts that need to take place in our society and environments. I have a lot of hope in the generation coming behind us. I have a 15-year-old as well as 2 high school graduates right now, and my children know things that, and you guys, just hearing you speak today and hearing some of my students speak about the importance of making sure everyone feels seen, safe, and chosen and belonging. The language that's coming out is just so inspiring. And we millennials and Gen Zers, we old heads, we still have some changes to make, and you guys have a lot to teach. And I think that our allies, as we see them, are people who blend into the system already, who can help pull up the person who's trying to get a foothold, who can speak up to their peers when they see or sit or hear something. I have already seen cases where students are sometimes dismissed, or students who don't fit cultural norms are labeled negatively. And in that, it requires more than just say, it's going to be okay, buddy, pulled off to the side, or it requires more than just intervening when you hear a student teasing someone in the hall, or when a student comes to us for mental and behavioral health support and says that they're feeling left out. I think that there's been a long time of this idea that says, well, just suck it up and be tough, and we didn't used to be so weak. But that's the wrong language. And again, I really appreciate the language of mental health that has come across in social and emotional learning for the next generation, of saying, hey, my friend needs help. My friend's left out, lost, or alone. And that's not what a community does. A community lifts up its members. And so for me, I would say that the most impactful challenge, and one that I still face, is saying something when I see something, even if it means I'm a whistleblower, or even if it means I am now being watched a little bit harder because maybe people need to sit up straight when I walk in the room.
I would say the most impactful challenge probably in regards to diversity is the now. Looking kind of in a bigger scheme of things, there has been tremendous funding cuts in DEI efforts. in healthcare, in non-healthcare, in research. Was doing one of my biggest research projects was newborn resuscitation in Rwanda, and that also was cut with funding. And so there's been mentorship programs that where I had to change the name. Now it used to be, mentorship. It was a program for minority students, and now it's just a mentorship program. And you can be creative with the language and still do the same job, but in terms of, big the funding cuts, those are really hard when you need money sometimes to do big works, and something that we're still trying to navigate this space. And so I would say the now is hardest, especially in healthcare and research and programs for sure.
Yeah, thank you guys so much for those answers. So we know that the struggles regarding diversity in healthcare not only come from the interpersonal relationships and interactions, but also the institutions that are in place. And so, with that, I'm going to ask, do you feel that our current healthcare education adequately addresses cultural differences?
I feel like I don't know the healthcare education currently to address this question. Are you talking more like the high school health class?
Really and you can do it from a personal perspective, when you were in maybe clinicals or med school, how did they address cultural differences at all? Were there classes surrounding it, maybe discussions with your peers? Anyway, in your healthcare journey, how was that addressed, if at all?
Oh yeah, thanks for clarifying that. I think now it's gotten much, much better. My medical school, I would say like 4 or 5 years ago now, it was kind of getting the start of it. I purposely, when I was looking for residency programs, wanted to go to a residency program that put more emphasis in this and not just kind of, the people, but are there actual modules to be addressed? Are there speakers? Do we have protected time from our hospital duties to really learn and read? And so I feel like I specifically chose a program that had more of an emphasis, and so I would say yes, but I do know that there are many, many still programs out there that it's probably the lower priority that I chose not to attend, that can still have a lot more work to do.
Based on my healthcare education, so I did grad school for athletic training in Tennessee, in Chattanooga, Tennessee, which is the southeast corner. And based on our curriculum, I don't ever remember anything about any racial bias or gender equity or really anything that focused on cultural differences, even with religions or like something with fasting or anything with nutrition or physical touch or care from like a male clinician with a female patient. None of that was actually kind of discussed. I probably got more of that in my education for teaching and kind of working with youth. I do think that programs, so athletic training, I'll speak to specifically since it's my own personal experience. Athletic training programs prepare you to pass the test, to pass the certification. And it's a 2-year program with different rotations. We had monthly rotations and then semester long rotations. And so they really focus on just what's on a test, right? And so as you move on through your education and your career, other things that might connect to cultural differences and equity and things like that, it might be a PD, right? It might be something that you have to seek out yourself. It might be panels just like this one, and you may not have direct access to it in your programs. Or there's different certificates or other things kind of to develop your practice. And so you kind of have to keep an eye out for that. You kind of have to understand what you might be lacking or what your biases are, and how to work on those kind of in the future. Because a lot of things are just focused on the certificate or the national certification or licensure, um, versus the whole kind of person or folks that you work with. So you just kind of have to understand that as you move forward throughout your different careers.
I would say that the program that I am in right now at Gonzaga, it really focused heavily on equity and inclusion, and I appreciate it. We learned a lot about the cultures represented in this community, as well as cultures at large in our country that we'd be interacting with. A lot of the National Association for School Psychologists testing questions were regarding working with diverse groups. And I was very pleasantly surprised in how forward thinking the training was, the questioning were, simply because I, as a woman of several decades old, have seen how education has evolved over this time period where we used to sort of, as we were saying earlier, only focus on using information that came from one set of people in reality. And we were just extrapolating that to the whole group. And now we have studies coming out, longitudinal studies, 5, 10, 20-year long studies of people from rural areas specifically, or from the inner cities specifically, or from the LGBTQIA plus community specifically, and how to best provide service and care for those groups of people, where I don't think that wasn't happening in my early 20s when I was doing undergrad. So I think that there's we can have a lot of hope moving forward for the future, and we can carry that torch of information as we move forward. So I think it's adequate. It's become more adequate, but we still have room to grow.
Thank you for that perspective. So, our last question for you today is, how can healthcare professionals actively engage with and serve diverse communities to improve overall health outcomes and build trust?
I think we've touched on the significance of being curious and asking questions with humility, and venturing out and being kind. Healthcare professionals who bring some information, because like Anne said, it's not the responsibility of the person to explain to you how to treat them. Like, on some level, respect is respect, and we should give everyone the opportunity to have freedom in the space that we meet them in. And that means giving people positive regard on site, not just based off of what you think you know or may have heard about them. But if you are in a caring profession, then your job is to serve, and to serve with kindness and understanding, and ask those questions in a way that isn't offensive. And if you don't know what that looks like, find out ahead of time if you can. And if you can't, say that. I think honesty, and people can see intentionality, and I think we can sense amongst one another when someone is being disingenuous with us. And that can come from having as many experiences as you can by meeting people and being brave. And it can also happen in the moment. But start with a question and a greeting and a smile if you can.
I feel like there is so many ways that you can engage with your communities. I think the first with in I think this is also like 5 years ago, there was a lot of words and emphasis on cultural competence. And really, it should be cultural humility. I don't believe that I will ever be competent on someone else's culture that I have not lived with, or have experienced. And so it's really, recognizing that you don't know everything and really asking instead of assuming. There's even in our healthcare, we can ask, is there any religious beliefs that is important for me to know? And that will be really important for me to know when we're, thinking about different nutrition types, thinking about, how we can work with them to be aligned with their religious values and beliefs. Um, how do you prefer to make medical decisions for your family can also be really different with every culture. And so being more curious, asking questions instead of assuming is the biggest thing. And I would say really work with your community. It's so easy to be comfortable within your own community, but volunteer at different health fairs, different food banks, different local advocacy groups that have specific focuses in the populations that they serve. There is a county jail that residents can work with the doctors there, and that has been an incredible experience too, just to understand what is that population, what we can do to better serve them. Medicine and clinicians, it is a service job, and I love that because you can really connect with your patients. It's, when they come to you, whether it's in your clinic or a hospital, they share very vulnerable, you know, sharings, and it is such a privilege to be in that spot where they feel comfortable to share it with you, and it's a privilege. It's not a right. And so I'm always really thankful for our teens, our preteens, our children's. Since I am a pediatric resident, that's the population I serve. But when they come to me and they feel safe and they are excited to share the things that has been happening with them, and it'll never be like that if I don't ask them the questions and I just assume. And so I think that's the biggest takeaway for me.
Aside from what both folks have said so far, I think as you're active within your profession, usually you're a part of, a professional organization, and there's committees that you can be a part of. You can look at, data or health evidence, especially when you're making decisions, and see where that data comes from. Check out the demographics, make sure that it's actually geared towards the population that you're trying to serve. And it's, if you're within your education, once you're looking at programs, I mean, look at the rotations, ask those questions, see who your program serves, what opportunities do you have? Are you able to go to like rural areas? Are you able to go to more urban areas? Are you able to, work with different government, entities? And kind of keep an eye out for that, and have those conversations with your clients, with your patients, in a respectful, open manner, and you'll really kind of understand just the wider breadth of people that you'll work with. And I think that's just imperative for a healthcare professional.
All right. Thank you guys so much. It looks to be about the time to start wrapping up. And so thank you again to all of our panelists for taking the time to hop on and be here with us and converse with us and share your experiences. I'm sure that everyone tuning in, whether it's on the Zoom or via YouTube, has been able to take away something insightful to think about as they go on with their careers in healthcare, which is exactly why we do this event every year. The WCTSMA and HOSA share a very strong passion towards the healthcare community, and we know we share that same passion with you guys. So once again, thank you for being here with us. Thank you for everyone else who was behind planning this event. And if that is all, we hope you all have a wonderful rest of your evening. Thank you.
Thanks all so much.
Yeah.
Thank you so
Thank
much.
you all. Have a good night.
Have a
Thank
good
you
night.
guys.